you for choosing Dallas Surgical Arts for your surgical needs. I will be discussing post-op care for a dental implant patient. A dental implant is the procedure that you elected to have in place of a tooth that was previously there. A dental implant, just so you can see here, is what we like to call a root replacement. So it goes in the exact extraction site of where the tooth once was. The nice thing about dental implants is you can actually floss in between them once they're healed, just like a normal tooth. During the recovery time, what you're going to have is one of two options. One, either the implant will be completely covered up with gum, which means you're going to have a gap in between the two teeth like so. If that's the case, then you're going to treat this area just like normal. We'll ask that you chew on the opposite side for 2 weeks after the procedure to give the gum tissue time to heal. And there will be one stitch in place, which will have you come back for a 7 to 10 day follow-up to remove that suture. Until that time, you'll just kind of treat the area like nothing happened. If the area is not covered up, you will have a little metal cap in the area called a healing abutment. The healing abutment is not your final abutment. It is only in the place for the 3 to 4 months that it takes for an implant to heal. The healing abutment cannot be chewed on like a normal tooth, and we still ask that you chew on the opposite side for 2 weeks after the extraction and the implant placement. The healing abutment, though, will collect plaque if it is not brushed. So after day 7, we ask that you gently brush the little cap so that way we have no plaque collection on the cap. There is still going to be a suture affixated to the gum tissue here that we'll take out the 7 to 10 day follow-up. With dental implants, a lot of times prescriptions for afterwards, you just typically need ibuprofen, usually extra strength, usually 600 milligrams is what we do. Hydrocodone for pain. We will prescribe an antibiotic when placing the dental implant. Depending on health history, it could be penicillin or clindamycin. We'll do a prescription mouth rinse, and then we'll do anti-nausea medication for this as well. With dental implants, you can typically go back to work the next day. It's not typically too painful of a procedure. It does have a little soreness, but nothing that I think is requires you to like be home for a couple days after work. If you want to take the time, you're more than welcome to. But if you need to get back into it, you can do that typically the next day. Dental implants, very great procedure. We do ask that you just be mindful with sleeping kind of propped up for the first 2 to 3 days after surgery, just to help with swelling, and then any post-op pain. Diet for dental implants, we just typically just soft stuff for a couple days. Once you're ready to progress your diet, you can, but we do ask that you chew on the opposite side that the implant was placed. If you had implants placed on both sides at the same time, we'll just ask that you stick to like pastas, soups, jello, things that are kind of easy to digest without chewing too hard, at least for 7 to 10 days. If you just had it on one side, then you can chew whatever you'd like on the opposite side. Typically, when people start eating a full diet, they are a little bit sore kind of in the jaw area. I typically recommend just a little ibuprofen to help kind of get through that hump of soreness from eating again.